Welcome back to the second round of business. My name is Colin Limawani. Abel Sitole has been appointed as the CEO of the PIC and Executive Director on the Board of Directors. Sitole is currently the Principal Executive Officer of a Government Employees Pension Fund. His appointment will be for a period of 5 years. The business rescue practitioners for SAA have shut down the airline's plans to take off when the country moves to lockdown level 3. Yesterday, SAA released a statement saying it plans to take to the skies in the middle of June with the resumption of domestic flights. But the practitioners say the airline statement is in violation of the communications protocol put in place to avoid the issuing of unvetted messages. The business rescue practitioners say flights will remain suspended until SAA has a better sense of what lockdown level 3 means for domestic air travel. They say the airline's future funding also remains a key variable in all of the above considerations. Furthermore, the practitioners say SAA statement has created rather unfair expectations on the relevant stakeholders, including customers as well as employees who are on unpaid absence. The airline's financial woes have worsened due to the travel ban. South African healthcare group RH Bophelo has finalized a secondary listing on the Rwandan Stock Exchange. The listing comes at a time when Africa and the world face a major health crisis, which has further plunged economies in many countries and halted operations in major sectors. The company believes that this move is the beginning of a new era that will reshape the scope of healthcare on the African continent and come up with opportunities. So let's get more on this listing and we are joined by Quinton Zunga, who is the CEO of RH Bophelo. Thank you very much for joining us.
Thank you so much, and welcome to your guest.
All right. How did the need for this listing come about, and what does it mean for RH Bophelo?
So the listing has come about in that we are trying to expand on South Africa, and we are opening up the continent because we are saying healthcare should work for everyone. And East Africa is the next place that we need to reach in order to get this dream. And we chose Rwanda because it has really good, friendly regulations that actually support the listing for us.
Is this part of scaling your company? And of course, whilst you're doing it, is the scaling not done in terms of expanding your operations around the country rather than doing a secondary listing in another country?
So we're looking at it in stages. The first, obviously, is to get the South African core of our business working. And I think we have a good strategy. We've got a good plan, which is to focus on the low end of the market, provide access, which we're doing through a product called Westmart, which for affordability. But what we are then saying is that the continent has the same attributes on the low end as this same market, and we want to expand this model. But before we go outside South Africa, we said let's have a secondary listing to get understanding of that market first before we actually start the investments.
So have you observed the operating environment there, as well as observing the performance of that board in general, as one would say that Rwanda has been doing well as an emerging market?
So we have observed it, and we think, for instance, the regulatory is very friendly. You can actually, we were virtually listed, in fact. We also think that it had allowed us the accommodation because Rwanda wants to set up a financial services center. So what we have been trying to do is support them in that endeavor, as well as giving ourselves a profile in that market in order for us to expand. So we think that exchange is going to grow. It is linked to all the other 3 exchanges in East Africa. So the opportunity for our name to be profiled there is significant.
So how do you expect your growth forecast to pan out in as far as the way your stock is going to perform upon the listing, and the reaction that you expect from the market in terms of bringing money in when you're raising capital on the financial markets?
So we are very, very excited about our stock. Very excited because we are tapping into a market that no other healthcare group is looking at currently. And we think this market is mainly of the low end, which are employed by uninsured. And the statistics we have was that it was around 3 million people. And with this hardship going on, that is likely to expand. And what we think, we can entrench ourselves to be a leader in that market by using our infrastructure and our products. And we think it is supporting the government, it is supporting the public, and it's definitely an economical viable proposition, which we are focused on right now.
All right, so do we know how your share price has been reacted to here in the country on the local bourse? And what was your pitch when you started listing there? And paint a picture for us on how it was received by the market. Was there any kind of level of interest from the buyers?
So yeah, that's an interest. Thank you for that. So the liquidity in our stock is still very difficult, which has made it a bit hard for everyone to trade. The key thing to note is that we have not introduced yet new shares in the Rwandan Stock Exchange. So it has not been it has been listing by introduction. So we are going to do a capital raise. We are going to get more liquidity in our stock, which is going to reflect in our share price. But we are excited on this adventure, and we think we can deliver for the South African population and thereafter for East Africa.
All right. Congratulations on your listing, and thank you very much for taking time to speak to us. We believe that when your share price keeps on going high, you will remember us here in the country.
Thank you very much. We will.
Well, Quinton Zunga is CEO of RH Bophelo, which is a health group which is listed here in South Africa, and of course having a secondary listing on the Rwandan Stock Exchange. And of course, that's our business for now. We'll be back after this. Stay with us.